Welcome. In this video module, we are going to explore one of the most important regulations in healthcare, that is HIPAA, the Health Insurance Portability and Accountability Act. Whether you are a healthcare professional, an administrative staff member, or work in an organization that handles patient information, understanding HIPAA is absolutely critical. It's not just about compliance, it's about protecting people's privacy, building trust, and ensuring the safe handling of sensitive health data. In this module, we'll break down what HIPAA is, why it matters, and what your responsibilities are under the law. You'll learn about protected health information, key rules like the privacy rule and the security rule, and how to stay compliant in everyday situations. Let's get started because safeguarding patient information starts with you. Hi, I'm Anusha from Sinova Consultants LLP. I am a HIPAA certified healthcare professional working in this domain for the last 3 years. Today I'm here to give you an overview about HIPAA and how HIPAA functions. Please stay tuned with the video. Let's get into it. HIPAA, the Health Insurance Portability and Accountability Act, is a federal law enacted in 1996. Its main goal is to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. At its core, HIPAA is about privacy, security, and trust. It sets the standard for how healthcare providers, insurance companies, and their business partners handle protected health information, commonly referred to as PHI. HIPAA covers both the privacy of health data, who can see it, use it, and share it, and the security of the data, ensuring it's stored and transmitted safely in both physical and digital forms. Whether you're a doctor, a nurse, an admin, or part of a healthcare support team, HIPAA applies to you. Understanding what it is and why it matters is the first step in protecting patient rights and maintaining compliance. In the next slides, we'll break down the key rules under HIPAA, what counts as PHI, and your responsibilities in keeping health information safe. As part of the revenue cycle management team, you're on the front line of handling sensitive patient data like names, dates of services, insurance details, diagnosis, and billing codes. All of that falls under PHI or protected health information. HIPAA matters because it ensures that this information is handled with care, confidentiality, and legal compliance. Even though you're not delivering clinical care, you're still responsible for protecting patient privacy at every step, from verifying insurance to submitting claims and managing payments. One wrong click, one unsecured file, or one shared detail with the wrong person can lead to serious breaches, financial penalties, and loss of patient trust. By following HIPAA guidelines, you help keep patient data secure, protect the organization from risk, and ensure that healthcare operations run smoothly and ethically. Bottom line, HIPAA isn't just a legal requirement, it's a core part of doing your job right in RCM. So what does HIPAA expect from us? Pretty simple. Keep patient info safe and private. If you see or handle PHI, things like names, medical records, or insurance details, treat it with care. Only use it if you need it for your job, and don't share it with anyone who shouldn't have it. Always keep things confidential, whether you're talking, emailing, or just walking away from your computer. Log that screen. If something seems off, like a lost file or a weird email, speak up right away. Reporting issues quickly helps protect everyone. And don't forget to follow the basic security steps, like using strong passwords, keeping devices secure, and not leaving paperwork lying around. At the end of the day, HIPAA is about protecting our patients and doing the right thing. Alright, let's talk about covered entities. Sounds fancy, but it's pretty straightforward. Covered entities are the people and organizations that work directly with patient health info. That includes hospitals, clinics, doctors, nurses, health plans, and even some billing companies. If your job involves accessing or handling health information to provide care, process payments, or manage healthcare operations, you are part of a covered entity. Under HIPAA, your role is to protect patient info, use it only when needed, and keep it secure. That means following privacy rules, locking things down digitally and physically, and speaking up if something goes wrong. Basically, if you work with patient data, HIPAA expects you to treat it like it's your own. So, what's a business associate under HIPAA? Basically, a business associate is any person or company that helps a healthcare organization and handles patient info while doing it. Billing services, IT support, legal teams, cloud storage providers, even sharing companies. They are not doctors or nurses, but they still work with protected health information or PHI. Because of that, business associates have to follow HIPAA rules too, just like the healthcare providers they work with. That means keeping PHI private and secure, only using it for what's necessary, and reporting any breaches or risks right away. In short, if you're a business associate, your job is to help, but also to protect patients' data like it's your own. Why HIPAA matters to us, the RCM team. Okay, So we are part of the RCM team handling things like patient registration, coding, billing, claims and payments. We are not giving direct medical care, but we still deal with a ton of sensitive patient information every single day. That's why HIPAA really matters to us. We are working with names, insurance info, diagnosis, procedures, all of it is PHI and it has to be protected. If we accidentally send the wrong bill, email the wrong person or leave a screen unlocked, it's not just a mistake. It could be a HIPAA violation. Our job is to make sure patient data stays secure and only gets used the right way. That protects the patient and it protects our organization too from fines, legal issues and damage to trust. Bottom line is that we are not just processing data, we are protecting it, and that's a big part of staying HIPAA compliant. A quick look at the evolution of HIPAA. Let's take a quick trip back in time and look at how HIPAA came to be. Originally, it was meant to help people keep their health insurance when changing jobs. But over time, it became all about protecting patient health information. Fast forward to 2009, we got the HITECH Act. This was a big update. It pushed healthcare providers to start using electronic health records, and it made security and privacy rules even stricter, especially for electronic data. It also started holding business associates to the same standards as covered entities. Then came the Omnibus Rule in 2013. Think of it as a major tune-up for HIPAA. It brought everything together. HIPAA, HITECH and a few other rules into one big, stronger version. It gave patients more rights over their info and increased penalties for violations. So yeah, HIPAA has come a long way from paperwork to protecting digital data in a high-tech world, and it keeps evolving to stay ahead of new risks. Let's talk about what happens when HIPAA rules aren't followed. Yup, we're talking penalties. HIPAA violations are taken very seriously, and usually the fines depend on how bad the mistake was and whether it was avoidable. We can categorize them in 4 different categories. Coming to category 1, unaware but should have known. This is when someone didn't know they were breaking the rules, but they should have. For this, the penalties could range from $100 to $50,000 per violations, reaching up to $1.5 million per year. For an example, accidentally emailing PHI to the wrong person and not having proper safeguards in place. Category 2, reasonable cause. Here, the violations wasn't intentional maybe, but it happened because policies or training were lacking. The fines could range from $1,000 to $50,000 per violations. Example, staff didn't receive proper HIPAA training and mishandled PHI or protected health information. Category 3 could be willful neglect getting fixed. This means the rules were knowingly ignored but corrected within 30 days of the mistake. The minimum fine could range from $10,000 per violation and it goes up from there. Example, a known risk wasn't addressed, but once discovered, the issue was quickly recovered. Category 4, willful neglect not fixed. This is the worst one. It's when someone knowingly breaks the rules of HIPAA but does nothing to fix it. The fine could start from $50,000 per violation, and yes, it adds up fast. For an example, ignoring repeated warnings about unsecured patient data and never taking an action. And keep in mind, penalties can include criminal charges too, depending on the situation. So, moral of the story, always follow HIPAA policies, stay alert and speak up if you see something wrong. It's better to prevent a violation than pay the price later. The HIPAA security rule is all about protecting electronic patient information or ePHI. It tells us to handle data safely, whether we are storing it, sending it, or accessing it. That means using strong passwords, secure systems, and being careful about who sees what. It also gives patients the right to access their own health information safely and privately. Bottom line, keep patient information protected and treat it with the utmost care that it deserves. It makes sure we protect health data stored or shared digitally, like in emails, systems, or apps. That means using strong passwords, secure logins, encryption, and locking devices when not in use. It's not just an IT thing. Everyone has a role in keeping data private and secure. If it's patient's information and it's digital, the security rule says protect like it's gold. The HIPAA breach notification rule. What happens when data gets exposed? Imagine this. Patient information like medical records or insurance details or social security number accidentally slips out, maybe through a lost laptop or a hacked system. That's where the HIPAA breach notification rule kicks in. It's like the alarm bell for data mishaps. If there's a breach, the healthcare team has to act fast. They need to tell the people whose info got exposed. No hiring, no waiting. They also have to let the government know, and sometimes even the public, depending on how serious the breach is. Why so? So that the patients can protect themselves, watch for fraud, change passwords, or take other steps to stay safe. When data leak happens, transparency is the key. The breach notification rule makes sure nobody is left in the dark. What is a remediation plan for HIPAA issues? When we discover a HIPAA issue, whether it's a data breach, a policy gap, or a mistake in handling patient information, we need to act quickly and effectively. A remediation plan is our clear step-by-step approach to fix the problem. First, we identify exactly what went wrong. Then we outline the actions needed to correct it. This could involve updating security measures, revising company policies, providing additional staff training, or tightening who has access to sensitive data. It's about making sure the issue is fully resolved and putting safeguards in place so it doesn't happen again. Ultimately, the remediation plan helps us strengthen our HIPAA compliance and protect patient health information moving forward. Alright, now that we have covered the basics of HIPAA, let's move on to an important update called the HIPAA Omnibus Rule. This rule came out in 2013 and it basically tightened up the original HIPAA regulations to make them stronger. One big change, it brought business associates like billing companies, IT folks and vendors fully under HIPAA's rule. Before this, some of them weren't held to the same standards, but the Omnibus Rule changed that. Now, they're responsible for protecting patients' info just like doctors and hospitals. It also gave patients more control over their own health information. For example, it made it easier for them to get copies of their records or request corrections if something wasn't right. And the Omnibus Rule made penalties for violations more serious, so everyone understands how important it is to protect patient privacy. So this update made HIPAA stronger, held more people accountable, and gave patients some extra rights. Let's talk about PHI. That stands for Protected Health Information. It's basically any information that can identify a patient, like their name, address, medical records, or even insurance details. Why do we need to keep PHI safe? Because it's personal and private. If it gets out where it shouldn't, it can lead to things like identity theft, embarrassment, or even discrimination for the patient. Plus, keeping PHI safe is not just the right thing to do, it's required by the law. So, whenever we handle this info, we have got to be extra careful and respect the trust that the patient puts in. Remember, protecting PHI isn't just a rule, it's how we respect and care for our patients. If you work with patient health information through healthcare or related services, HIPAA is your rule book. Risk analysis is the first step to keeping patient data safe and staying HIPAA compliant. Alright, let's talk about how we keep electronic PHI safe. There are a few types of safeguards we use. Firstly, the administrative safeguards. This is all about the rules and training, making sure everyone knows how to handle info right and following the policies. Next, physical safeguards. Think locked doors, secure workstations, and making sure only the right people can get to devices or files. And then we have the technical safeguards, more like passwords, encryption, and firewalls that keep hackers out and protect data when it's stored or sent. All these safeguards work together to make sure electronic PHI or ePHI stays private and secure. Let's talk about EHR, which stands for Electronic Health Record. An EHR is basically a digital version of a patient's medical chart. It stores important info like medical history, medications, test results, and more, all in one place. The great thing about EHRs is they help healthcare providers share info quickly and securely with the right people, like doctors, nurses, or specialists involved in the patient's care. But here's the key. Access to the EHR is controlled. Only authorized staff who need the info to do their job can see it. That keeps patients' info private and protected. And when should PHI be shared from the EHR? Only when it's necessary for treatment, payment, or healthcare operations, and always following HIPAA rules. So, an EHR is a secure digital way to keep patient info organized and available, but only to the right people and at the right time. Let's talk about the HITECH Act. It's a law passed in 2009 that really boosted how we handle electronic health information. HITECH stands for Health Information Technology for Economic and Clinical Health Act. Its main goal was to encourage healthcare organizations to use electronic health records, or EHRs, more widely and securely. Now, how does it affect HIPAA? Well, HITECH strengthened HIPAA rules, especially around electronic data. It pushed for better security, stricter breach notifications, and bigger penalties if patient info isn't protected. Basically, HITECH made sure that as healthcare went digital, patient privacy and security stayed front and center. Malware, short for malicious software, is a program designed to harm your device or steal data. The types of malware includes viruses, worms, trojans, spyware, etc. etc. Signs of infection: slow performance of your system, frequent crashes of your system, strange pop-ups, missing or locked files. How to avoid malware: keep your software updated, use antivirus, avoid suspicious links and downloads. Also, don't forget to back up your data. Remember, stay alert and you can stay safe from malware. Alright, we're almost at the finish line. Just a couple of key points left to cover. Let's start with encryption. Encryption is basically a way of locking up digital data so that even if someone gets access to it, they can't read it without the right key. It scrambles the information into a secret code. Only authorized users with the right passwords or systems can unlock it. Why does this matter? Because if encrypted data ever gets lost or stolen, it's much less likely to be considered a breach, since the info is unreadable to anyone without access. Now, what is a breach? A breach happens when protected health information, or PHI, is accessed, shared, or exposed in a way that wasn't allowed under HIPAA. This could be anything from emailing patient info to the wrong person to a hacker stealing data. If a breach happens, it's important to act fast. Report it immediately to your privacy or compliance officer. The organization will investigate and determine how serious it is. If it is confirmed as a breach, HIPAA requires that we notify the affected individuals, the Department of Health and Human Services, and sometimes even the media, depending on how many people were affected. The goal is to stay transparent, take responsibility, and protect patients from further harm. So, encrypt your data, follow protocols, and if something goes wrong, report it right away. And that's a wrap on our HIPAA training. We have covered what HIPAA is, why it matters, how to protect patient info, what to do if something goes wrong, and the key rules we all need to follow, like the privacy rule, the security rule, and the breach notification rule. Just remember, patient information is private, valuable, and protected by law. Whether you're handling records, sending emails, or just having a conversation, treat that info with care. HIPAA compliance is everyone's responsibility, and when we all do our part, we help build trust, protect our organization, and most importantly, respect the people we care for. Thanks for staying tuned, and if you are ever unsure, just ask or report it. It's always better to be safe than sorry.